right. Which of the following is most likely cause this patient's symptoms? Right. Seems like a cardio question here. 56-year-old man with a history of hypertension, smoking presents to the ED with sudden severe onset of chest pain radiating to the back. Pain is described as tearing in nature and has persisted for 2 hours. Physical examination, blood pressure 170 over 110 in the right, 145 over 95 in the left. Pulse is 90. Systolic murmur is best heard at the left sternal border. EKG shows no evidence of ischemia or infarction, and chest X-ray reveals a widened mediastinum. Okay. Let's see. So he has a systolic murmur on the left, heard best at the left sternal border. So we know a systolic, it's either aortic stenosis, pulmonic stenosis, MR, or TR. So if this is at the left sternal border, could be TR. Right, that would be or it could be pulmonary. Let's see, hypertension, smoking. All right, severe. It's tearing. It's going to his back. Um, 2 hours.
So what's the diagnosis? Would you say? So don't
I'm
look at
trying
the
to.
answers.
So I'm trying to think of this diagnosis. I'm not sure. Like pain, radiating to the back. Hmm. No, when I think radiating to the back, I think of like pancreatitis. This is not the correct system here. It's probably too high too. That's my first thought. I know that's like
So that can
tangential.
also cause you radiate back pain. So that's on the differential. But
Yeah, that's what I was thinking. Just with the radiating back pain, I'm like, okay.
what else
Um,
can cause you radiating back pain, though?
I like when I think of like pericarditis and stuff, I'm thinking of the pleural chest rub. I'm usually thinking that's the front, not the back.
Okay,
Um,
good.
Radiating back pain could just be hmm, like something more lung related. Um, I'm not too sure. Broken rib. Um, yeah, radiating to the back. I'm trying to think of if there's
There's only a
something else.
couple things that radiate the back. I think you're missing one big one. I'm trying to.
Is it spleen or
So it's going to be in the cardiac world.
okay. Radiating to the back. Uh is it aortic? Like tearing or something like
Yeah.
that?
Okay. What is
Okay.
that called? Aortic tearing.
I'm trying to think of
What's the fancy medical term for
um
tearing?
why can I not think of this? It's not esophageal varice. Is this the thing that's the emergency? I'm trying to think of
So
it,
let's
it's
go with. Say it again.
it's not thoracic aortic aneurysm, is it? No, I don't think so. That's
So,
not the
so let's go back to the diagnosis. Don't look too much with the
okay.
answer choices, right? So you came up with a diagnosis that was aortic tearing. So we'll go with that. Okay.
Okay.
We'll kind of after we answer the question, we'll kind of talk about specifically what the medical terminology for that is. But let's say aortic tearing. So now because you understand what I mean, I want you to think of the diagnosis first, and
Okay.
then you have to pick an answer choice that fits that diagnosis. You know what I'm trying to say?
Okay. So is this the method where you're not sure with something and you do it, excuse me, this way? Or is this like what kind of like is this a strategy I could use when I'm doing my questions and stuff? I was like if I don't know it right away to think of the diagnosis, or is that
Well, you have to. The thing that you need to always be doing is you always got to think to yourself, what's the diagnosis first,
okay. Okay.
regardless of the question. You gotta
Okay.
you gotta come up with like, and sometimes when you're taking this test, sometimes it's not. Let's say you get stuck and you can't figure it out, then your chances of getting an answer is going to be lower, right? Because you can't come
Right.
up with the diagnosis yourself. But you have to kind of get into the groove and the habit of always trying your best to come up with the diagnosis yourself,
Okay. Okay.
because it's going to give you the highest likelihood of getting an answer right. Because when you get used to that and you're looking at this and you're like, oh, okay, to me, this seems like it's a, aortic tearing in your mind, right? So
Okay.
then you want to then look at the answers. Okay, which one of these answers can lead to aortic tearing. You understand the
Okay.
difference?
Yes.
Yeah.
Okay, so if we think it's that aortic tearing, which I can't remember the correct term for, um, and there is no evidence of the ischemia or infarction, it's either got to be aortic regurg or aortic stenosis. I'm thinking it's stenosis causes that, and that regurgitation doesn't, because if it's stenotic, it's going to be tight. If I remember that correct, and it's like that buildup of calcium, it could be. Um, let's see, his blood pressure is higher in the right than in his left. I mean, I don't know if that makes sense for that. On the left sternal border, I would think it'd be more on that right sternal border. Um, thoracic aortic aneurysm also makes sense. But I
Yeah, what's your
don't.
gut say?
Um, hmm. TAA. I don't think that that's. I would say aortic stenosis, but I'm not super sure.
Okay, let's talk about this. Okay,
Okay.
so the diagnosis that you need to be looking for, aortic tearing is actually a good way to say it, but the medical terminology is aortic dissection.
Okay.
Okay, aortic dissections is a super heavy emergency because your biggest artery in your body has a tear through its lumen, which is not good.
Hmm.
Okay, and the things that increase that, one is a thoracic aortic aneurysm, meaning you have a bleb on the aorta already, meaning that that area of the aorta's wall is weak, increasing
Okay.
your chances of an aortic dissection. The way that you know that's an aortic dissection, or here on the question is, it's an emergency, right? He has a history of hypertension, smoking, which also causes vascular weakening, right, and inflammation.
Hmm.
It's sudden, right? He has chest pain radiating to his back. So we talked a little bit during the question of what can cause it, but make sure you add that, right? Chest pain radiating to the back, right? Is going to a lot of times be aortic dissection. Okay. Tearing nature lasts for the last 2 hours. And then the reason why the blood pressures are different from one arm to the next is because where the location of that tear is. Remember,
Okay.
the aorta, right? It branches off, right? With your brachiocephalic, right? Your common
Hmm.
carotid, right? Etc.
Left.
Right.
Right.
So, depending on where it tears, you're going to have different blood pressures. That's always a good sign too that you can look at. And then systolic murmur, right? That's just the murmur from the tear, that it's like some reflux of the blood there. And then widened mediastinum. The reason why it's widened is because if you think about, if you have your aorta here, right, and you have a tear through the lumen, what ends up happening is blood is going to, flow in between the lumen of the vessel. And what happens is, as it dips down and you see your cardiac silhouette, this area is going to be widened because of this dissection.
Oh, okay.
Okay, that's why you have a wide and mediastinum. So,
Okay.
yeah. So does that make sense? What I mean by kind of try your best to come up with a diagnosis?
Yes. Yeah, because that would have helped a